It's 10 past 2 here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities. We should be getting a breakdown of the latest case numbers, as well as updates on prevention measures, as well as the vaccine campaign that began late last week. It looks like the briefing is going to start here in just a minute. And an update on the figures. On Monday, there were 355 new cases of COVID-19. That number is lower than it had been in recent days, but reports say that's most likely because fewer tests are being done over this long holiday weekend as Korea celebrates March 1st, the independence movement anniversary that 102 years ago when Koreans demonstrated against Japan's imperial rule of the Korean peninsula. So that brings Korea's total case numbers to date to a little over 90,000. And there were 2 new deaths as well from the virus, bringing the total death toll to 1,605. And now, in the meantime, we're going to get a little bit more news here on the virus and other issues. For example, South Korea's political leaders on Sunday agreed on a budget proposal to fund the country's 4th round of COVID-19 relief payments. That budget's worth 20 trillion won, or about 17.7 billion US dollars. And these payments are for small businesses, freelancers, and others whose employment's been impacted by the pandemic. Officials say the money for a broader group of people will be provided compared to the last round, though individual payment amounts have not yet been announced. Our Hong Yoo has the details on that.
The ruling Democratic Party and the government have agreed on a plan to make emergency relief payments worth a total of 20 trillion won, or about 17.7 billion US dollars. In a high-level meeting Sunday between the government, the ruling Democratic Party, and the presidential office, they agreed to draw up a supplementary budget proposal to fund the country's 4th round of COVID-19 relief payments this week. With the 4th round, they aim to minimize blind spots. The payments will be going out to a wider group of people this time.
We've broadened aid for groups whose employment is at risk to include freelancers and corporate taxi drivers. We can now give special scholarships to university students who are going through economic difficulties due to their parents having lost their jobs or their stores.
The payments this time will be going to 2 million people more than the last round. A bill for the extra budget will be submitted to the National Assembly this coming Thursday.
On the close agreement between the government and the ruling party will come with a system to compensate for losses. A profit-sharing scheme will serve as a stepping stone to overcome the crisis.
The budget plan includes the money needed for vaccine purchases, building up infrastructure for the rollout, and free vaccinations for all Korean citizens. The payments could be dispersed as soon as the end of March. Hong Yoo, Arirang News.
Now we're waiting for the briefing to begin from the South Korean health authorities, scheduled for 2:10. It looks like that's starting now.
Let us now begin our regular briefing on the COVID-19 situation here in South Korea. As of March 1st midnight, we have a total of 338 new local infections and 17 new imported cases. And the current caseload now stands at 90,029. And currently we have 7,354 people remaining in quarantine, and there are 131 patients with critical or severe conditions. We had 2 additional fatalities, and the death toll now stands at 1,605, with the fatality rate standing at 1.78%. I extend my deepest condolences to the deceased and the members of the bereaved families. And as of today midnight, here are some updates on our domestic updates. And today we see 338 new domestic cases. 262 were reported in the capital area, which account for 77.5%, while 76 have been reported in the non-metropolitan area. And here are some major cluster infections. And we also have provided you the press kit for the details. So refer to that. And here are some weekly risk assessment indicators. And we are seeing during the past week 370 cases as the daily average confirmed cases, which is a 7.8% drop from the previous week. And during the past week, we also seen 21.1 confirmed cases of imported cases, and which is around the average of the past 4 weeks. And in Honam and Gangwon-do province, we are seeing a slight increase of the domestic infections, while the rest of the regions, including the capital area, we are seeing a slight drop in the new cases. And during the past week, here are some sources of infections. And also, as for the contact with previous cases, they accounted for a majority, about 35.6%, and about 28% stemming from cluster infections, and 8.2% that is from cluster infections from hospitals and nursing homes. And we had about 155 cases of imported cases, and we also have about 23.5% cases which are under investigations. And we see that we are seeing a slight decrease on week as for the cases of cluster infections and nursing hospitals. And we had a total of 8 new cluster infections. And also, we have seen a major cluster infection stemming from businesses, and they range from the manufacturing facilities to call centers. And we have many facilities that are related to these manufacturing facilities. And we also see cluster infections stemming from day-to-day venues, as well as family gatherings and so forth. And during the past week, we also see a slight decline in the number of fatalities and the patients with critical or severe conditions. This has been on a decline since late January. The fatality rate also stands at about 1.78%, which is slightly lower. However, we still see high fatality rate among those aged 80 and above. And we have seen that majority of these fatalities were above the age of 80 during the past week. And as for the major sources of infection, as for these new fatalities during the past week, we see a majority of the cases, about 59.9%, were from cluster infections from hospitals and care facilities. And we are seeing 3 cases which are under investigation, and aside from them, all of the others had underlying illnesses. And here are updates on our new variants. Starting after the 25th, we have been carrying out new virus studies, and we see that out of the 153 domestic cases, no new variants have been identified. While for the imported cases, we looked at the 28 cases. However, we identified 14 to be the new variants. 11 of them were the new variant from Britain and 3 from South Africa. And in particular, this South African variant, all of these 3 people were foreigners, and they also were from they departed from Tanzania, all of the 3 foreigners. And we have seen 156 new variants reported here in the country, and 133 are the UK variants, 17 South Korean variants, and the 6 others are the Brazilian variants. And as for the new 14 new variant cases compared to last week, we have seen that 12 people have been reported at the points of entry, while the rest of the 12 have been identified while on self-quarantine. And we also have looked at the 2 people who were their immediate family members, and they are also on isolation, and they have also been tested. And as for the test, 1 person have tested negative, while the other one has tested positive. And we are also studying whether a person has been infected with the new variant. And all of them, the 2 people, have been identified while on on self-quarantine, so we do not have further local infections. And as for the influenza outbreak, we are seeing a level of under the annual average. And next, we also have some risk factors of COVID-19 and some words of recommendations to the public. The quarantine authorities are seeing continued cluster infections increasing from manufacturing facilities, and with the ease of the social distancing measures, we are seeing more physical contact and social contact. And also, starting from March, we also have higher risks of COVID-19 infections spreading across the community, with a new school year beginning among our schoolers. And in Chungcheong area, we are seeing more cluster infections stemming from facilities of the manufacturing facilities, especially those that are small and medium-sized. And also, they are in crowded and confined places. And we are also seeing that many of them employ migrant workers. And we see that many of them, these SMEs, have migrant workers. And as for these migrant workers, they live together at dormitories, so they are prone to cluster infections. However, they have limited access to testings as well as medical facilities and care. And due to their status, residential status here in the country, they are limited to these benefits as well. And looking at the Chungcheong areas and in the middle of the country as well, we are also intensifying our quarantine inspection for these SMEs, especially their manufacturing facilities. And as for some facilities, we will be carrying out massive testings as well as a preventive measure. And second, as we have eased the social distancing measures, we are seeing more increased people taking part in the social gatherings and so forth. We are seeing more cluster infections of social gatherings, religious facilities, and so forth. And with more warmer weather, we also see that people will be also moving more around the country. And we also see many day-to-day facilities like saunas, public bath, and academies like the music academies and private academies, and the indoor facility, sports facilities like spinning and so forth, as well as restaurants and social gatherings and family gatherings. We are seeing these as the major venues of cluster infections. So we once again would like to highlight that we are intensifying our quarantine measures and inspection for these multi-use facilities, and we will be intensifying these facilities if they breach any of these protocols. And we will also encourage the epidemiological investigations for these people, and we will also identify the people of high risk group, and we will also intensify our quarantine measures within the local community. And next, we also have some increased risks stemming from the beginning of the new school year from March, and we are seeing that the primary students, especially those in grades 1 and 2 and kindergarten students, will be going to offline classes on a daily basis. And we also see at university campuses, they also will have more movement after the new beginning of the school year. And to this end, the quarantine authorities will cooperate with the Education Ministry. We will make sure that we look at the shared facilities within the campuses, and we will be looking at the people with any suspicious symptoms and any clinical symptoms, and we will make sure that they will also abide by the ban on gatherings of 5 or more people. And fourth, we are also seeing higher risks of the new variants spreading here in Korea, and there are also more countries reporting the new variants as well. And here in the country, we are seeing a more influx of the new variants as well. And right now in Korea, we are also at the risk of being exposed to the new variants, not only from these 3 countries, however, from other countries like Japan or the US and so forth. So to this end, we are also mandating, starting from the 24th of February, for all of the inbound travelers, whether they be foreigners or Korean nationals, to present a PCR negative document. And they are also subject to a mandatory 14-day quarantine here upon arrival. And they are also subject to 3 times of the PCR testings. And also we are carrying out isolation if they also have been tested positive so that we can stem the further spread of the new variants. And to this end, we would also like to highlight that until the day of reaching herd immunity through vaccinations, we will also want to highlight the importance of social distancing measures. And starting from the March 1st, we also have the extended new social distancing measures. And also starting from tomorrow, we will beginning the new school year to many schoolers around the nation. So we ask for the students and faculty members to abide by quarantine measures. At each of the households, we ask you to look after your children's health conditions before going to school. And please upload your children's conditions on a daily basis up on the database as well as the application. And if you have any symptoms, please do not go to school. And if you are at school, please wear your face mask at all times. And the schools also need to disinfect and ventilate on a regular basis, and also highlight and guide your students to also comply with these social distancing measures. And as for universities, we also ask you to reduce the amount of congestion at shared facilities like cafeterias and lecture rooms and dormitories and so forth, and comply with the social distancing measures. And all of the private gatherings should also be switched to non-face-to-face means, including orientation sessions. And next, we still have some updates of the COVID-19 vaccinations as of March 1st. Yesterday, we had 765 people being administered with the first dose of COVID-19, and currently we have administered the vaccines to a total of 21,177 people, and a majority of them were given with the vaccines at the nursing hospitals, about 7.9%, and we also have about 4.3% being reported at the nursing homes and facilities. And these are some updates of the inoculation plans. And as for the side effects of COVID-19 vaccinations, some of those that have been reported, we see 152 cases have been reported, and we believe that these are mild symptoms that could frequently appear after vaccinations. And a majority of them also had about 76% had fever, or some also had about the muscle pain and also fatigue, and we did not have any report of severe symptoms. And after the vaccinations, we have seen that these side effects were some normal responses after the vaccinations, and we believe that they disappeared after 3 days. And we need to also monitor these conditions if you develop any kind of adverse reactions after inoculation, and painkillers could help. However, if the symptoms become worse and if you have a severe allergic reactions, please visit your doctor as soon as possible. And to this end, we are also monitoring any of the adverse reactions, as we have more types of the vaccines to be rolled out here in South Korea. And we will also ask all the doctors to report any cases of these adverse responses to the national database. And we are also asking all of the recipients to also report their symptoms if they develop any adverse reactions. And we are also seeing and having a sample of these recipients, and we are also sending out questionnaires so that they could monitor their conditions for the next 6 weeks after inoculation. And starting from the 26th of February, we have been rolling out the vaccines for the workers at the nursing hospitals and care facilities. And after the inoculations, many of them had received interviews, and they said that they are relieved that they can look after the senior patients, and many of them had similar kinds of answers. And during the past 1 year. We believe that these workers had also a high level of nervousness as they looked after the senior patients. And they were tested on a regular basis as part of our preventive measures, and they limited their private gatherings as well. And we also like to extend our deepest appreciation and respect to all of them. And now we have rolled out our vaccines here in Korea. However, until the day we reach herd immunity after the second dose of the vaccines, we ask you to comply with the social distancing measures going forward. And after the 8th week, we also ask you to get your second doses as well. And right now we had over 20,000 cases, recipients of the vaccines. However, we do not have had any severe allergic reactions. However, as we have more people receiving the vaccinations, we believe that we could have severe allergic reactions like the anaphylaxis. So we would like to minimize any damages going forward by monitoring the conditions on a strict manner. And many of the people could also see some side effects as well, like the pain in the injection area. However, these also can disappear after 2 or 3 days. So please take good rest, and also if needed, please take painkillers, and please monitor your conditions going forward. However, once again, if your symptoms persist longer than this, please visit a doctor, and the quarantine authorities will also monitor the conditions going forward. Thank you very much.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.